If you're taking Ozempic or even just considering it for weight loss or type 2 diabetes, this video is a must watch. While there's no denying Ozempic can be incredibly effective, it's also not a magic fix. And like every medication known to man, it comes with trade-offs. As an internal medicine physician, I want to give you the full picture, not just the benefits, but also the risks, the side effects, and the key things you should consider before or while you're taking a GLP-1 medication like Ozempic. So let's dive into the research and what it shows and what most people don't realize or talk about. Surprise! Ozempic can lead to fast weight loss, especially in the first few months. Its consistent effectiveness at making weight loss easier is part of what makes it so exciting and why it's extremely popular. But here's what the data shows. If you don't change your eating habits, your physical activity, and your overall lifestyle, there's a high chance the weight will come back once you stop the medication. This is not unique to Ozempic. It's true for any medical intervention that doesn't include long-term behavioral change. Think about your fitness challenge, your last one. What happened once the challenge was over and you went back to your old comfortable habits? Right. So, yes, it helps with appetite suppression, but the real problem is assuming that Ozempic alone is the final solution. Another issue that isn't talked about enough is people don't just lose fat, they also lose lean muscle. Studies have shown that a significant portion of the weight loss from GLP-1 medication comes from lean body mass. And this matters because muscle helps regulate your metabolism. And when you lose muscle, your resting calorie burn goes down. And that makes it even harder to maintain your weight over time. If you're taking Ozempic and you're not strength training or getting enough protein, you're at risk of slowing down your metabolism for the long term. Most patients experience at least some degree of GI issues, nausea, constipation, diarrhea, bloating, and for some folks, these side effects can be so brutal that they have to stop the medications for a time or completely. These side effects are commonly mild and expected, especially during the first 4 to 8 weeks as your dose increases, but for some people, they're not mild at all. Nausea usually happens on the lower doses and can be managed by eating smaller meals, but still it can be an uncommon reason to have to stop the medications altogether. Others deal with chronic constipation or GERD, which affects quality of life and even your nutrition because you start avoiding certain foods just to feel better. This isn't meant to scare you or anyone, but you deserve to know that these are real and common problems, and they're not just adjustment symptoms to everyone, and I'm not here to sugarcoat it for you at all. Now that we've covered some of the more common and more mild symptoms, there are some more serious, though less common, issues to be aware of. There's data showing a slight increased risk of gallstones, particularly in patients losing weight rapidly. Again, something that can happen with or without GLP-1 medications. There have also been concerns about pancreatitis, especially in those with a personal or family history of pancreatitis. Actually, pancreatitis in your history is a no-no for these medications. Now, these risks are rare, but they are not zero. That's why this medication needs to be monitored by a real doctor who knows your full medical history and what to look for if they show up. Hey, come here. Come closer. Ozempic is expensive. So if your insurance company does not cover it, or if you're paying out of pocket, you could be spending anywhere between $400 to $1,200 a month. And that's not sustainable for most people for the long term. Even if it's working well, that cost becomes part of the problem when it leads to financial stress or when you're forced to stop abruptly. And because demand is so high, there were major shortage issues, which allegedly have been fixed, but honestly, my patients still complain about availability. Some patients who rely on it for diabetes are having trouble accessing it because there are some folks out there who are being prescribed the medications widely for weight loss off-label. By the way, I now offer prescription programs where patients can get the appropriate weight loss versions of the GLP-1s, that's Wegovy or Zepbound, and that's shipped directly from the manufacturer, Novo Nordisk or Lilly Direct, but I'll talk about that more later on. Now, here's something most people don't talk about, and we don't have long-term outcome data for, and that's people taking GLP-1s purely for weight loss over the last 5 or 10 years. Yes, we have solid safety data for diabetes management, and so far it appears using these meds for weight loss will be just as safe, but GLP-1 agonist long-term use for weight loss in otherwise healthy people, that's still being studied, and the final verdict is still out. We don't know exactly how the body adapts, whether tolerance builds or what the risks are over decades. That's not a reason to avoid it, but it's a reason to stay informed and make sure you're working with a provider who keeps up with the data. So, are there problems with Ozempic? Yes, like every medication, there are trade-offs, but if you go into it with the right expectations, with the right physician guidance, if you treat the medications as a tool, not a cure, and if you're willing to make the right changes alongside it, Ozempic can be incredibly powerful. If you're already on a GLP-1 or just getting started and want support, I invite you to join my free GLP-1 bootcamp. You'll get 14 days of expert guidance, real-world tips, and my full GLP-1 nutrition guide, designed to help you get the most out of your medication while protecting your health long-term. And if you're looking for a reliable way to access Wegovy or Zepbound, I've also added a link in the description below for my GLP-1 evaluation and prescription program, so you can get the medication delivered directly from the manufacturer through Novo Nordisk or Lilly Direct. Stay healthy, stay informed, and I will see you soon.